Hello all, my name is Neha Pandit. Today I am going to present the topic that is basics of the monophasic liquid. So in this topic, it is comes under the course outcome that is BP 103T2. It means that it understands the basics of the different dosage form. So in this topic you will see the basics of the monophasic dosage form. So what are the dosage form, what are the monophasic dosage form. So we will see one by one in this topic. So next, we will see what is meant by monophasic liquids. Monophasic liquid dosage forms are the true or colloidal solution. True means clear solution. The component of a solution which is present in the large quantity that is called as a solvent, and the component which is present in the small quantity that is called as the solute. The solution is a homogeneous mixture because the solute is an ionic or the molecular form of the subdivision. So in case of the colloidal solution, the solute is present in the aggregate form, but we cannot see by our naked eyes. We can see only under the ordinary microscope. So next is the classification of the monophasic liquids. So what are the classification? So first it divided into two types, that is routes of according to the routes of administration and the types of vehicle. So in the routes of administration, it's again divided into two types, liquid for the internal use and liquid for external use. For internal use, the examples are the syrup, elixir, linctus, and drop. And liquid for external use, in that the liquid to be applied on the skin, that is in that liniment and lotion. Liquid meant for the body cavities, in that example gargle, throat paint, mouthwash, ear drop, eye drop, nasal spray. And second type on the basis of type of vehicle or according to the type of vehicle, in that again divided into two types, aqueous liquid dosage form and non-aqueous liquid dosage form. So next we will start the first monophasic dosage form, that is solution. So what is meant by solution? Solution, in that solute and solvent when we mix together they form the clear homogeneous liquid that is called as the solution. The solution are the dosage form prepared by dissolving active ingredient in an aqueous, that is water, and non-aqueous without water solvent. So it is a homogeneous mixture of two or more substances. It again divided into three types according to the routes of administration, in that oral solution, that is for oral, we can take by oral route. Then otic solution, otic means ear, then ophthalmic means eye, then topical means on the skin surface. Second type is the according to the composition and uses, in that syrup, elixir, spirit, aromatic water, tincture, and injection. And third is the according to the vehicle, there in that two types, aqueous solution and the non-aqueous solution. So next we will see the definition of the what is meant by concentrated dilute solution, saturated solution, or unsaturated solution. So first, what is meant by concentrated solution? The concentrated solution with the greater proportion of solute is present in that is called as the concentrated solution. And if we see the definition of dilute solution, in that less proportion of solute is present is called as dilute. So what is difference between concentrated and dilute solution? In dilute, more proportion of the solute is present, that is called as concentrated solution, and less proportion of the solute is present, that is called as the dilute solution. Next term is the saturated solution. So what is meant by saturated solution? The solution in which we cannot add the more solute at a specific temperature or a given temperature, that is called as the saturated solution. And next is the unsaturated solution, means a solution in which more solute can be dissolved at a given temperature is called as the unsaturated solution. So next is the what are the advantages and disadvantages of the solution. So first advantages is easier to swallow, more quickly effective than the other solid dosage form, absorb rapidly because it is in the liquid form, then uniform dose can be withdrawn, and irritation is reduced by administration of solution of the drug. So what are the disadvantages? So solution is a liquid, so therefore these are bulky and inconvenient to transport and the store. Stability is the more problem because it contains the water, so growth of microorganism can be occur. So needs an accurate spoon to measure the dose. If we take the any spoon, then we cannot measure the accurate dose of the solution. So these are the advantages and disadvantages of the solution. So next monophasic dosage form is the gargle. So what is meant by gargle? Gargles are the liquid preparation intended to apply locally to the oral and throat cavities. So in that the vehicle used in preparing the gargle may be aqueous or the hydroalcoholic. Hydroalcoholic means water plus alcohol. It is called as hydroalcoholic solution. So gargling. What is meant by gargling? Gargling is the human act in which the air from the lungs is bubble through a liquid in the mouth. So vibration caused by the muscle in the throat and back to the mouth, the liquid to bubble and percolate through the throat and mouth cavity. So what is the main use of the gargle? The gargle are used to treat the sore throat and throat infection, and also it provides the soothing and healing effect. So gargling, you can see in the picture. So next, mouthwash. So mouthwash is the need of the mouthwash is a result of condition called as the halitosis or the bad breath. So mouthwash are the aqueous solution with a pleasant taste and odor used to make clean and deodorize the buccal cavity. So what a mouthwash are designed to eliminate the bad breath in two ways. So first way is that they relieve it by killing the bacteria and responsible for producing the bad odor or foul odor, and the base of this product prevent the bad breath as long as 8 hours. And the second way is that mouthwashes help to reduce the bad breath is by masking the odor. So this is much less effective method which lasts no more than 30 minutes. So what are the uses of mouthwash? Mouthwash are used to make clean and deodorize the buccal cavity, as well as are used on the mucous membrane of the oral cavity and the throat to refresh and mechanically clean the mouth. So next monophasic dosage form is the throat paint. So what is meant by throat paint? It is mainly the viscous liquid preparation it used for the mouth and throat infection. So in that it is viscous. That's why we use the glycerin in this throat paint, because it is used as a base, and being a viscous, it adheres to the mucous membrane for the long period of time, and it possesses the sweet taste. So throat paint must be more viscous because they are designated to prolong contact of the medicament with the affected site or the area. So what are the example of the throat paint nowadays? Iodine throat paint, iodine potassium throat paint, tannic acid throat paint, and clotrimazole mouth paint. So next dosage form is the ear drop. So ear drop it mainly used for the ear. So ear drop are solution of the one or more active ingredient which extend a local effect in the ear. They may also be referred as the otic or the oral preparation. So in that propylene glycol, oil, glycerol for increase the viscosity, and water may be used as a vehicle. So what is the main use of ear drop? To prevent the ear infection as well as infection in the outer or inner ear. And second is a bacterial infection are sometimes treated with the antibiotic, because they may be useful for also they may be useful for the softening the ear wax and treating the infection or inflammation. So what are the example of ear drop? That murine ear drop, cyprosin ear drop, and polysporin ear drop. So these are the example of the ear drop. Next, nasal drop. So mainly it is used for the nasal purpose. So nasal drops are the solution of a drug that are instilled into the nose with the help of dropper. So nasal drop are the isotonic. Iso means same. Tonicity, in that we maintain the tonicity to nasal secretion and buffer to the normal pH range of nasal fluid, that is pH 5.5 to 6.5, to prevent the damage to the ciliary transport in the nose. So what is the advantages of the or uses of the nasal drop? Nasal drops are used to treat cold and allergies and work on the specific site rather than the whole body. Nasal route is useful for newly biological active peptides and polypeptide, which is needed to avoid first pass metabolism or GI, that is gastrointestinal destruction. So most of frequent use of nasal drop is for the decongestant for the cold, then to administer local steroid for the treatment of allergic rhinitis. So what are the examples of the nasal drop? Are the nasoline nasal drop, then xylomate nasal drop. So next is the enemas. So what is meant by enema? What is the main purpose of the enema? The first one is to relieve the constipation problem. It delivers the medication, also prepare for the medical procedure, as well as to treat the fecal infection. So what are enemas? Enemas are the oily or aqueous solution that are administered rectally, means, and they also known as the clister. So there are microenemas are there. Microenemas means small single dose, are the small single dose of small volume solution that is less than 0.5 liter. Then large volume, in that the volume is present 0.5 to 1 liter enema should be warmed to the body temperature before administration. Next is the enemas are usually given at a body temperature in quantities of 450 to 900 ml, injected slowly with the enema syringe. If they are to be retained in the intestine, they should not be used in the larger quantities than 180 ml for an adult. So there are two types of enema, namely evacuation enema and the retention enema. So what is the example of enema nowadays? Hydrocortisone enema for the local action and aminophylline enemas for the systemic effect. So next is the syrup. So what is meant by syrup? Syrup is a highly concentrated aqueous solution of the sugar or a sugar substitute which traditionally contain the flavoring agent. So strength of the sugar in syrup is 66.7% weight by weight. The syrup is used as a vehicle for medicine. It is usually used as a flavors vehicle for the drugs. It also masks the taste of the bitter substances of the formulation. So there are many three types of the syrup. First is the simple syrup, second is the medicated syrup, and third is the non-medicated syrup, or it is also called as the flavored syrup. So first, simple syrup. What is meant by simple syrup? Simple syrup IP is the 66.7% of the weight by weight sucrose solution in water prepared by solution method. In simple syrup USP, sucrose at concentration of 85% is dissolved in the water. So these are sometimes used as a coating on the surface of the tablet. So syrup is protected from the bacterial contamination, as well as if we use more dilute syrup are the good media for the microbial growth, because in that water is present in a more amount and require the addition of the preservative. So what is the main purpose of preservative? To prevent the growth of the microorganism. So syrups are the saturated solution of the sucrose. So in water, thus exert the high osmotic pressure and no free water is available for the microbial growth. Hence, preservative is not required to be added in the simple syrup. So what is the example? Simple syrup IP, simple syrup USP, as well as simple syrup BP. Next is the medicated syrup. In that, the medicated syrup is a nearly saturated solution of the sugar in water in which drugs are in which drug or drugs are two or three drugs are dissolved. So this syrup contains the medicinal substances giving them the therapeutic value. So example in that ephedrine sulfate syrup for the cough. So uses it can mask the taste of the salty and bitter drugs, and it used as a vehicle for the pediatric use due to their high viscosity and the smooth mouth feel qualities. Due to the wide variety of flavors of syrup such as orange, lemon, peppermint are widely acceptable in the medicated syrup. So next, third type is the non-medicated or the flavored syrup. So what is that? Some syrup does not contain any therapeutic agent. Instead, they consist of the various aromatic or pleasantly flavored substances and is intended as a vehicle or flavor for the preparation. So it's called as the non-medicated or the flavored syrup. Example, cherry syrup, orange syrup and cocoa syrup. So what are the components? So mainly sugar, then antimicrobial preservative, flavorants, colorants, and miscellaneous in that the solvent, solubilizing agent, thickeners. These are the components of the syrup. So next, what are the advantages and disadvantages of the syrup? So advantages, syrup has the ability to mask the bad taste of the drug and can be administered easily to the children. Thick character of the syrup has a soothing effect and resistant to the microbial growth and attractive to the youngster. So what is the disadvantages? Patients who have the consumed food having less calorie should be aware of amount of sugar present in the syrup. Patients taking syrup regularly are at a risk of the dental caries as well as not suitable for the diabetic patient, and crystallization of the sugar takes place if the container is left open. So next is the elixir. So what is meant by elixir? Elixir as a clear, sweet and hydroalcoholic liquid intended for the oral use, containing the flavoring substances or the active medicinal agent. So their primary solvents are the alcohol and the water, and next with the glycerin, sorbitol, syrup, sometimes as an additional solvent or the sweetening agents. So these are prepared by the simple solution or admixture of the several ingredients, and they use either as a vehicle for the therapeutic effect. So according to their definition, elixir is divided into two groups. First is the flavored syrup and second is the medicated syrup. Flavored syrup, it is used for the flavor and vehicle in prescription, and medicated syrup, it is used for the therapeutic effect or properly of the medicinally active agent. So what are the example of the medicated syrups are the dexamethasone elixir and phenobarbital elixir. So next we will see the liniments. What are liniments? Liniments are the solution or mixture of the various substances in oil, alcoholic solution of soap or emulsion. They may contain the suitable antimicrobial preservative and are intended for the external application. So they were called as the embrocation, and liniments usually are applied with the friction and rubbing of the skin. So liniment should not be applied to the skin that is broken. The oil or soap base provides the ease of application and the massage. So in that, alcoholic liniments are used for their rubefaction and counter-irritant and mildly astringent and penetrating effect, as they penetrate the skin more easily than the oil-based liniment. The oily liniments are the milder in their action but are more useful when massage is required. So next, depending upon their ingredient present in the liniment may function as a solely as a coating, protective or clothing. For example, white liniment. So what is the function of the liniments? Liniments for use contain antipruritic means itching problem, then astringent, emollient means soothing or analgesic, and are classified on the basis of their active ingredient. And liniments usually contain methyl salicylate, menthol and camphor in their preparation. So what is the main uses of the uses? It is acts as a local irritant, mild rubefaction and weak local anesthetic. So next is the lotion. So what is meant by lotion? Lotions are the usually liquid suspension or dispersion intended for the external application to the body. It applied without friction, and the wide variety of ingredients may be added to the preparation to produce a better dispersion or to accentuate the cooling, soothing and drying or protective properties of the lotion. So good example of the suspending agent used in the lotion is that the bentonite. Then methyl cellulose or sodium carboxymethyl cellulose, which localize the and hold the active ingredient in contact with the affected area. So next is the formulation containing glycerin will keep the skin moist for the considerable period of time, and addition of alcohol to the formula will accentuate the drying and the cooling effect. So what is the uses of the lotion? It a dermatologist frequently prescribe the lotion containing the anesthetic, antiseptic prevent the microbial growth, then astringent, germicide means kill the germs, then protective or screening agent to be used in the treating and preventing the various types of the skin diseases and the dermatitis. Dermatitis means the skin inflammation or any infection to the skin. Then antihistamines, benzocaine calamine, resorcine, steroid, sulfur, zinc oxide, and zirconium oxide are common ingredient in the unofficial lotion. So this is all about the monophasic liquid dosage form. I hope you will get the you will get a clear understanding about the more monophasic liquid dosage form. So this is all about these monophasic liquids. So thank you so much.